Hello, how are you doing? This is Puya Devudi. I'm at Aesthetics Center of Gainesville. I'm going to be talking to you today about tummy tucks. There's a lot of questions and comments that people have about not knowing what a tummy tuck is. Is it covered by insurance? Is it something that you need to have for sure, or is there other alternatives? And so I think I'm just going to first talk about what a tummy tuck is, and then you can decide and we can decide what else we can do. So to start off with, let's just go over some illustrations. Tummy tuck, otherwise known as abdominoplasty, the big formal word for it, has to do with a lot of times after you have babies, you have excess skin, excess fat in your abdomen, and sometimes that muscle gets stretched. So what we want to do in a tummy tuck procedure is kind of reconstruct the abdomen back to prior to the baby, to the pregnancy, and also try to reform the abdomen back to what it used to be. But you don't necessarily have to have a baby to need a tummy tuck. Some people have a tummy tuck when they have just excess weight and skin. They have had massive weight loss. So there's many different reasons you can have a tummy tuck. To start off with, let me just give you a quick overview of tummy tuck. So you have a baby. In this little illustration you can see, you have a baby, and so your abdomen kind of looks like this, and there's a separation of muscle which occurs here. So normally there's a six-pack that goes down the middle, and what happens when you have a baby is you get a separation that occurs. Here's the next picture. Right here. So you can see this muscle has been separated. It used to be together, but it's now separated. The reason they get separated is that it allows the baby to be in the abdomen and kind of help create a nice little womb. And when that occurs and the muscle separates, it doesn't really go back together. There's an elastic tissue that is not so elastic in the middle, and as we age, that elasticity actually becomes less and less, and it separates and stays separated. So in a tummy tuck procedure, if you've had a baby and you have this thing called diastasis, which is a separation of the two muscles, then we can bring that back together by when we make an incision to go into the lower abdomen, lift that up, and then we can sew the muscle back together, as you can see here, and bring that six-pack back to where it was. Then if you have excess skin and tissue, what we do is we actually take that skin, cut out the excess skin and tissue, and you can see as it's being cut out, and most of the time the belly button hole is included in that, and what we do is we create a new hole on the skin when we pull everything down, and we put the stalk of the belly button back in place. So when all is said and done, it looks perfect. You get the nice shape. You have this contouring of the body, where it goes from more of a cubic shape to more of an hourglass shape, as you can see, because you're tightening that waist area. The key part to creating that shape is really tightening this muscle, because that cinches everything in. Now, let's say you haven't had a baby. Well, what's going to happen is that muscle is not going to be as separated, and in men is not as much separated, but you can still have a massive weight loss and excess skin. So instead of tightening the muscle, we just go and excise out the excess skin and create a new umbilicus hole. So that's the tummy tuck abdominoplasty procedure, kind of explained to you. There is some downtime associated with this. Is that you're tightening that muscle. That is a painful procedure, but the good news is that that pain is only temporary. At the Aesthetics Center of Gainesville, we actually use this thing that a lot of people don't use. It's called the infusion pain pump. The pump actually constantly puts numbing medicine throughout the abdomen, and we put that in at the time of surgery, and for about 4 or 5 days after the procedure, continuously diffuses numbing medicine around. So actually our narcotic use post-procedure has decreased tremendously. And I've had personally several patients that have not used one narcotic after the procedure. So it's actually a miraculous thing, this pain pump that we have in there. And the pain pump kind of stays in there for about 4 or 5 days. That comes out. At that time, the acute phase of the pain is over, and most people can get back to what they were doing before. And there is potentially drains also put in. A lot of us do still use drains, and the reason we use drains is because your body is going to produce fluids, and instead of having that fluid accumulate under that skin that we newly place down, the drains will help evacuate that and get you a better shape actually with the drains in place. Now, the recovery time can be anywhere from 2 to 3 weeks. Usually people bounce right back in here after the second week, and when all the drains come out and so forth, you can really get back to work soon after that. And there's some a small amount of downtime and stuff that about exercising that usually lasts about 4 to 6 weeks, just depending on the patient. So that's easy, quick little talk about tummy tucks, abdominoplasties, and it's pertaining per patient. So we actually have to see each person to actually give them a true evaluation, see if you are a candidate for abdominoplasty or a tummy tuck. So what other options do we have other than abdominoplasty or tummy tuck that you can do? Well, there's cool sculpting. Cool sculpting is a technique that works based on freezing fat. It's little to no downtime. You come to our office to evaluate you if you're a good candidate for cool sculpting. I had it done myself because I'm a surgeon. I can't take time off. Well, it was able to get rid of some of the problematic areas I couldn't get rid of when I was doing diet and exercise. So it helped me get to that. I didn't need a whole full abdominoplasty. So cool sculpting is a great option, but you have to be the right candidate for cool sculpting. The other thing that I think we need to discuss is diet and exercise. Yes, that does work for a lot of people. However, if you had a baby, and I see this in a lot of my patients that come in, it says, Dr. Davuti, I've been exercising, I have had multiple diets, I have trainers, I spend so much money, I cannot get rid of this pooch no matter how much I try. But that's because you need a tummy tuck. What's happened is they've had a baby, they've had that separation of muscle as we showed, and you're always going to have that pooch unless you surgically bring that back together. So although exercise and diet is great for toning up the body and putting you back into the shape, it's not good for reconstructing the body back to what it was before, especially if you've had massive weight loss. There's all that excess skin. You cannot get rid of that with just diet and exercise. You really need surgery to get rid of that. The advantage of also having a tummy tuck and then going back to diet and exercise is that it allows you to get motivated. You look in the gym, you look yourself in the mirror, and you look wonderful, you look great. Keep that body toned up with the diet and exercise. So these are all great options. Now, the cool thing that we have going on right now in the month of September, you're watching this on Facebook, you're loving this on Facebook, well, call us and to make an appointment for a free consultation, only for Facebook friends. You can call our office at the number of 770-534-1856. You'll see this on the post. Call the number, ask for April, and tell her you saw this on the video. She'll get you a free consultation with us, and we'll be happy to evaluate you and tell you if you're a candidate for a tummy tuck or a candidate for cool sculpting, or if you're a candidate for anything else that we offer at the Aesthetic Center of Gainesville. So I look forward to seeing you here. Thank you.